and welcome everyone to another edition of our traditional webinar, Ask Julie Anything. I am Mariana Nadai, Marketing and Events Coordinator at Adorbis, and I will be your host today. And today's webinar is dedicated to all cat lovers. And as a cat lover myself, I'm very excited to see so many people joining us. And during this session, Julie will be talking about the most common diseases in cats, like kidney failure, crystals and UTI, IBD and asthma, and how to work with them holistically. So don't be shy and ask Julie anything. And before we start, I want to ask for you all, if possible, to switch your chats to everyone so that we can all join in on the conversation. And please use the Q&A box at the Zoom bottom of your Zoom screen to ask your questions. So, we will do our best to get through all of them. So without further ado, I would like to enjoy Julie and Lee, everybody.
Hello. Just trying to look in the chat, see who is all here. Hi, kitty lovers. Oh, that's cute. I'm just analyzing on difficulties.
Yeah, we already have like 3 questions here in the Q&A.
Okay.
So Joanna is asking, how safe are rabies vaccines? Is there a risk of sarcoma? My cat is 3. She only had her kitten dose, but to be able to take her out of the country, an updated rabies vaccine is needed, and I'm hesitant. She's not had any vaccine since she was 5 months old. She's indoor cat. Do you recommend any repeat vaccines for her?
Okay, that's a good question. First of all, before I start, and hopefully, Joanna, you'll be able to answer some questions for me, because I do have a couple questions for you. But before I start, I'm excited to do this. Not very many people do just webinars on cats, and I adore cats. I love all animals, but I just feel like cats always get the end of the stick as far as being, really paying attention to them and stuff. I have 9 cats. So, yeah, I'm a real cat lover. And I also, just so you guys know, I was the main veterinary hospital for, a rescue called Vancouver Orphan Kitten Rescue. And we saw at our clinic probably about close to 2,000 cats a year, because we were the primary clinic for them. And everything from the newborns, like minutes old, to trap and release, to different ferals, all different ages. So cats are really in my wheelhouse. So I'm happy to be able to share some of that stuff. Speaking of which, yes, you do have to worry about sarcomas, vaccine-induced sarcomas with cats, big time, much more than with dogs, and especially the rabies vaccine. So my question was to you, when I look down at your question, you should be hesitant for sure. And I'm just wondering, you're saying that to take her out of the country, are you moving or are you traveling? Because that's going to make a big difference, right? That's the difference between night and day. Because what I would say is, if you're just traveling and you want to take your cat, I personally, if she was my cat, I wouldn't risk a vaccine to go on a holiday with my cat. I would just make sure that I had someone come into my house and take care of her. I wouldn't put her in a boarding facility either. So that's, that's speaking to that. But I don't, like I said, if you're moving, that's a totally different conversation. So maybe you could put in the chat, if it's possible. Joanna, if you're there and you can hear me, if you could please put in the chat so Mariana could take a look and see Oh, I thought I saw it. It's for travel. Okay. Can you add one more thing? Is it traveling like a long time, like 6 months traveling, or is it just a vacation? Hopefully she can put that in there. She's an indoor cat. Do I recommend any repeat vaccines for her? No, I don't. I don't recommend any more vaccinations. That's what we would say it, to our patients. And it's what I do with my cats. So, it depends on what you're subscribing to and your philosophies, but it sounds like already that you're hesitant because you've been doing your research, and that is something that that I wouldn't do with my own cats, as I wouldn't revaccinate an indoor cat for sure.
She said here that it's via vacation
Yeah,
travel. Yeah.
I saw that she said it was for vacation travel. So
Yeah.
that's what I said I wouldn't do it, and I would try and find a pet sitter. I wouldn't put her in a boarding kennel either. But I'm just wondering if it's like a 6 months traveling, that she's like traveling around the world, or is it just like a month or 3 weeks? If it's not for a really, really long extended period of time, I would definitely get a house sitter and not vaccinate her.
Great, thanks. Well, Sydney is asking, how do I get my cat from incessantly meowing for food at seemingly all hours of the day?
Yeah, so Sydney, depends on how old your cat is. Incessantly meowing for food can be a couple of different things. It can be boredom. It can be trying to get your attention. It's also very common for it to be hyperthyroidism, and it can also be cognitive disorder, like sort of geriatric cognitive disorder. And they all are treated very or dealt with very differently. So if your cat is older, maybe you could put in the chat how old your cat. He's 8. So, I doubt, well, I shouldn't say I doubt, they can have hyperthyroidism when they're 8. If this is something that's been slowly progressing and has come on more intensely over the course of six months to a year, it absolutely could be worth taking him to the vet and having his thyroid checked, because that is a symptom of hyperthyroid. Not sure if he's overweight or underweight, or those are all questions. Usually cats that are hyperthyroid, they want to eat all the time, but they don't gain weight. It's not like they're chubby. They're usually on the thin side, but then that's definitely not always the case. Boredom is a massive one. Massive. Cats, people just tend to think that because cats don't, well, your cat is asking for something, right? So you give him food and he looks like he has some satiety for a while, and then he asks for more food. So I have seen that tons and tons of times with boredom. So, possibly looking, if you rule out hyperthyroid and he's still doing it, then if it was my cat, I would definitely be trying to engage him in playing more. Oh my goodness, what's his name? Something Galaxy. Maybe somebody could put it in the chat. Not Justin Galaxy, but Jackson. Thank you, Jackson Galaxy. He's got some super cool videos where you can go on and see how to increase your cat's playtime and how you can play with them. Getting another playmate is a really good thing sometimes, depending. We just have to make sure that you really work hard to make sure that they're a good fit. But cats often hide their pain. They often hide their sadness or their boredom. They can show it in ways of overgrooming. So people think that, oh, my cat's got allergies, and they go down the road of a million different kinds of blood tests and different kinds of food and all these vet diets and all this to try to, certain proteins and stuff. And really, they are bored. and unhappy. So they start to overgroom. I even know people that have said that, you know, certain disease, a thing that a cat can get is or sort of like a compulsive disorder, or a where they self-mutilate and they just scratch, or they appear like they have allergies, but they actually don't. So I think a big part of a lot of diseases in cats, like sometimes bladder infections and interstitial cystitis, can definitely diet related, but are often associated with boredom because they're alone. Cats aren't pack animals like dogs, but they're very social. Like I have 5 cats in my barn, and those guys are doing everything together. And I mean everything together. They hunt together, they sleep together, they curl up together, they play together, they fight together. They're together like a family all the time. So this solitary life that we put our cats in really isn't ideal. That it really isn't ideal. And I really do feel like a big portion of cats' pathologies is because they're really unhappy. So that's something that I would definitely look into. Another thing that he could be meowing for food is if he's not actually getting the bioavailable concept or the bioavailable part from his diet. So I don't know if you've got him on dry food or you're feeding him raw food. You know, I'm not sure what you're feeding him, but maybe try changing his diet to something that's more real food. And if he's only 8 years old and you can get him on a real food diet, what would be great if you could get him on some chicken wings or chicken necks. I actually like chicken necks better. There's lots of different, I don't know whether we have, I can look in our thing and ask our girls to respond to this. If we have I think we have a raw food blog for cats, and I think we might even have one for chicken, how to start with chicken necks and stuff. And that is like, she said she's on raw and ours are to be ravenous too. So, you know, when you watch a cat eat, let's just talk about diet here, because I'm seeing some stuff in the chat about my cats love chicken necks and wings. She said he's on raw and ours are too, and they seem ravenous too. So again, we need to sort of throw out the window this concept that every single cat that's on raw food is like, you know, 100 grams per 10 pounds and whatever. It depends on your cat's activity. It depends on their breed. It depends on their anxiety levels. It depends on their, like, I could eat something and a girl that works for me could eat exactly the same thing. We could do exactly the same exercise and I would gain weight and she would get skinnier. So animals can be exactly the same. But when you watch a cat hunt, let's say, like when I'm watching my cats, if they're out there hunting, they're first of all, they're mentally stimulated all day long. They're looking and hunting and moving. And then when they actually do get a prey, the chewing action, the constant chewing action creates satiety. There is absolutely no doubt about that. When you chew, it's like, think of if you got all your calories drinking a smoothie, you know, so you're getting your bioflavonoids and your proteins and you're putting everything in there and you're slurping it back. Are you as satisfied as if you're chewing on something, right? Like actually chewing on something. And cats don't chew, most cats don't chew their kibble much. So saying, oh, well, would kibble be better? 100 million% not, because they chew on, they might chew on, like chew and then swallow, and half of them just swallow them. They hardly even chew them at all. It's not the same chewing action, and chewing kibble is really bad for their teeth. It creates dental disease and it shoves like a type of carbohydrate cookie material in between their gums and down in their gum lines and in between their teeth. We're not flossing cats' teeth, so it creates disease. Whereas when they bite into a bone, it doesn't break into that cookie type fiber and stick in between their teeth and cause decay. It actually scrapes their teeth and cleans their teeth and exercises their mandibular joints, and it keeps their ears healthier and their brain healthy because of that chewing action. So it's really, really important. And it's really great to keep them more satisfied and to keep them happier and to have them a lot more feeling full, for sure. So that would be my answer to Sydney for that. She also said, do cats really need the feline cancer vaccine? I honestly, I'm so scared to even say this sometimes because people think I'm just such an anti-vaxxer, and I'm so am not. But I can only speak from what I would do with my animals and what I do with my animals, and that is try and prevent things rather than try to stop things. So preventing something is putting an animal or a person in the state of health so that the body can respond to insults, right? And diseases. Trying to stop something is usually giving a drug, a vaccine, a artificial intervention to put a halt. Soon as you do that, you run the risk of side effects, and you run the risk of rebound effects, and you run the risk of mutation, and you run the risk of creating more allergies and more sensitivities. In comparison, the other way just builds health, and it builds resiliency, and it builds a healthier body that can maintain homeostasis. So that's my feline cancer vaccine answer. Okay, so do you want to go into the next one?
Yeah, the Allison is asking, raw feeding, should you use some with bones and organs and some without it?
So raw feeding, should you use some with bones and organs and some without? So you can use it like from a perspective of organs. Organs are really, really, really important, especially for cats. So, you know, they're getting taurine from heart. They're getting a lot of dense nutrients. Cats are carnivores, much more even than dogs. So for me, if you want to do, you don't have to put, if you're doing bones, like chewing bones, then you don't have to have bone in the food, so long as you're making sure that they're getting enough of the calcium phosphorus ratio. So if you can look at it, really, if you can look at it and go, okay, this is what a chicken would look like, or this is what, like, you want to have bone. The nice thing about bone is then you get the cartilage and the periosteum of the bone, and the marrow of the bone, which you should get in a raw food diet if it's ground like a whole carcass. So you really should be getting that. But for my cats, when I'm feeding a lot of bone, if I'm feeding a lot of chicken necks and things like that, then I will feed them one that doesn't have bone in it and has a little bit more, maybe like 3% fiber in it, 3% veg in it. And then I'll go to the opposite. If I'm not feeding any bones, or I'm not giving them a lot of bones, then I'll make sure that the bone's included in the complete diet.
Wonderful, thank you, Julie. So Cindy is asking, my cat is over grooming and pulling hair out. He was at vet last year for this and was giving asteroid. He does not have fleas, and I have switched food to grain-free.
So this is exactly what I'm saying. So, you know, there's neuropathy, there is allergies, there is compulsive disorder. So that's exactly what I was just talking about. If he's had, before I forget, steroids and cats are not particularly best friends. And I don't think steroids are particularly best friends for anything unless it is a very short-term fix for an immediate situation where an animal has a life-threatening situation happening. And then, you know, very careful weaning off of them is required for that. So I'm not anti-steroid, that's for sure, but I'm anti-steroid giving it just because we don't know what else is wrong, right? And cats get something called steroid-induced diabetes, and I've seen it hundreds and hundreds of times in my clinic, and where steroids are used specifically for stuff like that, like overgrooming, compulsive disorders, allergies, flea allergy, dermatitis, the list goes on and on. But if he doesn't have fleas and just switching to a grain-free diet, I mean, it's a start, but it's definitely not, I don't think it's the answer. Grain-free diet, it sounds like he's still on dry food. To me is just like, I don't want to call it a no-no because I'm not judging it from that perspective, but the two things that I would really say are the most detrimental to cats, one or three maybe. One is, I'd actually say boredom is probably for cats, indoor cats. I think boredom is probably the biggest precursor to disease. Two, or lack of attention, right? Two is dry food, and three would be over vaccinations. So when we think about cats and we think of dry food dehydrates cats. So even if he's over grooming and pulling out his hair, think about when you're dehydrated, you're not getting enough water, or you've been out in the sun too long and your skin is dehydrated. Cats aren't built to even drink water. They do because they have to, because they're predominantly eating dry food, but cats really aren't designed to drink water. They originated in a country where free access of water wasn't available. So if they were built physiologically to drink water, they wouldn't have originated in a country where it's a desert, you know? So they absorb their water through their blood of their prey. So the way they digest the raw meat or their prey, their body absorbs the blood. As it's absorbing the blood, it's the first step in digestion. So it's this synergistic process where the blood helps to break the food down, and then hydrate the animal, give that animal its hydration. And when you're feeding dry food, first thing that happens is it skips that process and it has to add an extra process. So it eats the dry food, the food goes in, there's no way of it properly digesting because there's not enough fluid in it. And even if your cat drinks and drinks and drinks and drinks and drinks, it's not coming in at the same time. Very rarely do you see a cat eat 3 kibbles and then go drink some water, and then eat 3 more kibbles and then go drink some water. By the time it eats and digests its food and then goes and drinks the water has to break down the kibble first before that hydration can happen. So there's extra steps in digestion, which then affects the pancreas in a really negative way. It's probably why we see cats that have obesity and a lot of pancreatitis, and diabetes. And the other thing is that we clinically dehydrate them. So cats that are eating dry food are clinically dehydrated, which then affects the kidneys. And I'm convinced, and a lot of other, really big feline veterinary practitioners believe that one of the main reasons for chronic disease and chronic kidney disease in cats is because of dry food. So whether it's grain free, it's not grain free, my suggestion to everybody is that they don't be feeding dry food. And if they can't feed raw, that they feed a really good quality canned or a really good quality freeze dried or dehydrated food that has been really well reconstituted, which means, you know, you put warm water on it and you let it sit so that it's fully absorbed with water, or add bone broth or something to it. And when you're doing that, if there's a lot of people out there that have cats that are already on dry food, you have to do this seriously crazy slow. So a dog, we can switch a dog onto dry food, from dry food onto raw food within 3 to 4 days or a week max. No problems, no issues. They're happy to eat it. They're excited. In fact, we have to be careful that they don't eat too much. Cats are completely different beasts. They either love it or they hate it. A lot of cats are completely addicted to dry food because that's how they make it. So you have to do it super slow. You can't, especially if you're free choice feeding. So if you have a bowl of food out for your cat every day, and then all of a sudden you go, okay, that's it, Buster, we're putting you on raw food because we want you to live till you're 20 years old. You can't just take their food away and go, this is for good for your, you know, you're going to love this. This is for your well-being. They will freak out because this is in their mind, their source of survival. And chances are they'll stop eating, period. They won't eat the raw. It's not like they're hungry. They're going to go, oh, I'm just going to eat this. Cats will starve themselves, and cats can't fast like dogs. If a cat doesn't eat for not even a very long length of time, they can go into something called hepatic lipidosis, which means that their liver becomes fatty from not eating, and then they get nauseous, and then they don't eat, and it's life-threatening, and they have to have feeding tubes, and it's a terrible thing, and I've seen it lots. So if you're going to do it, you do it really, really, really slow. You just take out a little bit of their dry and try putting down some raw. And then if it's good, you take a little bit more of the dry out and you put a little extra raw down. And I have people sometimes putting the kibble bowl down with three kibbles in it, even when they're on full raw, even when they're eating raw, no problem. My cat's fully switched on to raw. I'm so anal about both stress levels in cats that I'll get people to put just, 3 or 4 kibbles in the morning, 3 or 4 kibbles in the afternoon, and 3 or 4 kibbles at night, and leave that bowl there just to not freak them out and stress them out. If you can't get your cat on raw, it's not that easy. If it's not easy, I suggest to people to make tiny, tiny little meatballs like the size of your baby fingernail, and take a flat plate, like a saucer, a totally flat plate, and take some dry food and use a rolling pin and roll it into like a powder. And then you take the little meatballs and you roll the little meatballs in the crushed crumbs of your cat's regular food that it loves. It's dry food that it loves. And then you place them on the plate so the cat can easily pick them up. Because another thing that happens is that they're so used to dry that eating raw can sometimes freak them out. They can get, if it gets on their whiskers, it gets on their face. To begin with, it gets them, some cats are just super sensitive to that. So you just have to really take your time and slowly move into it. So the over grooming thing, for me, I would definitely be looking at way more attention, another friend, and switching to a raw food or a dehydrated, freeze-dried or canned food.
Thanks, Julie. So Suzanne is saying that she has a 4-year-old Persian. His teeth aren't great. Any suggestions on helping him keep them healthy?
Yeah, there's lots. The other thing I wanted to just say about the overgrooming cat, once you've got him on a food that has moisture in it, adding an essential fatty acid would be really good. So our potency would be really good, but don't do too much all at one time. Adding an essential fatty acid at the same time you're switching food is a recipe for disaster. But once he's on it and he's liking it, then you could add 1 drop of an essential fatty acid, of like an EPA, DHA, and keep adding it as he's liking it, because that's a really big thing for skin. So healthy gums is sort of just what I just said about food. The healthiest way to keep teeth clean is 2 things. One is diet, and having diet that doesn't create that dental plaque and that dental decay by sticking to their teeth and their gums and then rotting like dry food does, and giving them bones. Like once they're on raw, I would never give a cat a chicken neck that's eating dry food, because their gut has to be prepared to digest a raw neck and bone. So you would want your cat on raw food for at least a month, fully just raw food for at least a month before you would introduce a chicken neck. But this cat's 4 years old. If it's not on, I'm just I'm just trying to see. If your kitty's not on raw, I would put him on raw and then introduce chicken necks. The other thing for teeth is gut health. So bacteria in the mouth and bacteria in the gut, it's very similar, like the whole system of bacteria fighting bacteria, good bacteria fighting bad bacteria. So you can brush your cat's teeth, and it would be great to try and brush them with a probiotic instead of any kind of toothpaste. Cats don't love it, but you can dip your finger in a little bit of, let's say, Phytophthora, and put your finger in a little bit of water, dip your finger in some Phytophthora and rub it on their gums. You can do that. Or if he's eating canned food, dehydrated or freeze dried or raw, then you can just add a probiotic to their food, and that's really helpful for dental care as well.
Amazing. Ruth is asking, my 13.5-year neutered old Maine Coon cat has about a 2-inch area of seborrhea on the top of his tail near the base. It's very sore, and it causes his long fur to be very greasy and sticky. He has been on raw food diet for over 2 years and is receiving holistic only care. I don't know what to do to help him with this issue. I wash the area with soap and water, but it doesn't heal.
So I don't know what he's been diagnosed with. I don't know what this thing near his tail has been diagnosed with, but there is actually something called stud tail that even though they're not male cats, or even if they're neutered mats, it doesn't matter what sex they are, but it used to be called stud tail, which is a seborrhea. And it's right sort of at the base of the tail, maybe a little bit like this much farther down than the base of the tail. And it's usually there, and it's usually caused from hair follicles producing too much seborrhea, and it either produces too much or it can't excrete it properly. So in that case, I would try a homeopathic remedy on this kitty called Silica 30C, and maybe talk to your holistic veterinarian about a homeopathic remedy called Silica. And the other thing I would do is I wouldn't wash it with soap and water, because the soap, what's going to happen is the soap will kill the natural friendly bacteria. So it's not going to stop the seborrhea problem, if that's what this is, which it sounds like it is, but I don't know. You'd have to ask your veterinarian. And it will destroy the natural sort of microbiome of the skin. So what another idea to wash it with is you could use some colloidal silver in water and just rinse it. You could also use something more like I know what you're trying to do. You're trying to wash it to get the grease off. And I totally understand that and get that. But it's more about releasing the seborrhea so that it can actually get excreted. And to me, there's a deficiency of the yin yang and the heat and the cold that creates that a lot. So for me, I would work on that internally, and I would be doing pre and probiotics, and I would probably be doing something like phytosynergy, something with really high antioxidants, like SOD that phytoplankton has. And I would try working from the inside out first. The other thing that you could try using is our yeasty beast, so long as there's not any kind of open sores, because then it stings. You could take our yeasty beast spray, and you can spray it in some water, like so you're diluting it, or even our owies and oopsies, and you can bathe it with that. Maybe owies and oopsies is a little bit better because it doesn't. No, the apple cider vinegar is really good. I don't know. Depends on how sensitive your cat is. Start with owies and oopsies and mix it with a little bit of water and try rinsing it rather than using soap. So the hydrastis and the horsetail and all of that could help with the integrity of that area. Maybe you take off some of that sticky, oily stuff. And that's what I would try. I wouldn't use soap, and I would definitely try inside out for sure.
Nice. Thank you, Julie. Allison, she has another question about about a peeing cat. She's always done it, but it's been getting a lot worse lately. I'm planning to talk to a behaviorist. I like that question because we always hear how cats are like oversensitive. So I don't know if maybe there's something issue around this.
Well, and Allison, she's 14. Allison, where does she pee? Like she just pees all around the house? Or is she where is she peeing? Wonder if Allison can unclosed in bags and boxes. Okay, and has she been checked for a bladder infection? Probably, I would imagine. So while you're answering, Allison, while you're answering that, she peed on a power strip the other day in teletest on a power strip. So that a power strip, it was bad. L-test came back perfect. Oh, on a power strip. I understand what you're saying. So, okay, I see what you're saying. So she's been tested for a bladder infection, and it's negative. So let me just tell you something really quickly, because this is important for everyone out there that has cats, and especially everybody out there that has cats and with peeing problems. Definitely it can be behavioral, 100%. So if you've done a urine test and the urine comes back with like no bacteria at all, cats can have something called interstitial cystitis, and it's not something fun. It is really an awful thing for cats to have. And they can act like they're behaving badly when they have, and peeing all over the place, like peeing on clothes, peeing on bags. And a lot of times why they're doing that can be because they're trying to get your attention to tell you that there's something wrong. Also, why it can be is because they associate the pain with their litter box. So they're trying to find areas that they can pee on that doesn't hurt, right? That's not hurt, that where the association isn't just going to the box. So I would personally, I would try our easy peasy protocol, and I would do the whole protocol. I would also try our go-to with it. So I would do the easy peasy protocol, and I would do go-to 3 times a day for 2 weeks, and then twice a day for another 2 weeks, and then let our customer service know how your cat's doing, if there has been a shift in that. It says she will use the litter box. Yeah, they will sometimes. They'll use the litter box, then they'll try other places. I've just seen a lot of interstitial cystitis with those exact symptoms. And they've had behaviorists come in and they've done a whole bunch of stuff, and it winds up being interstitial cystitis, which is sterile cystitis. So there's no way of diagnosing interstitial cystitis unless you did an image like an ultrasound or CT scan, where you can see that if there's thickening in the bladder wall or inflammation in the bladder wall. But it's really, 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 really painful. And it's not painful like a bladder infection. They have sort of chronic bladder pain. So I would try that, and it doesn't hurt to also go. It also doesn't hurt to see a behaviorist, for sure. Behaviorist, doing different things with her. But I would get a behaviorist 100%, but I would definitely try the easy peasy protocol and the go-to, for sure. If you do the ultrasound, is it treatable? That, I think, says treatable. It's definitely well, vets will give you steroids for it, which I wouldn't recommend. I would go to a holistic vet. I've worked with so many interstitial cystitis cats. You have no idea. Tons and tons and tons of them, and it's totally treatable. And that's why I'm suggesting to try the easy peasy protocol and see how she responds to that, because that could give you more of a leading answer even before you even did an ultrasound. It should show if you did that and it was helpful with the go-to, then it's putting you in the direction that this is physical and pain, rather than just the behavior piece of it. Where someone said I'd use Demanos and corn silk to help treat my boys. I see. Yes. So before you go up, oh, I just lost it in the chat. Someone said, does Adored Beast, I use Demanos and corn silk to help. So Demanos is in the easy peasy protocol, and so is slippery elm, so is marshmallow root, so is a lot of things to calm down interstitial cystitis. It works incredible. And we've used it's the formula that I used in my clinic for interstitial cystitis, but I also treated them homeopathically. So there are I can think of 5 remedies right now that are like miracle drugs for interstitial cystitis, along with like the easy peasy powder, for sure.
Thanks, Julie. Nicole has an interesting question here. She uses nutritional yeast as a topper on her cat's beef raw, and she's worried with the food being raw and adding the nutritional is as a topper, will this be too much vitamin B and cause issues?
If you're not, well, you know what, that's really hard to speak to, because every formula, every raw food formula, premix raw food formula has a different formula, right? So I don't know, you'd need to look. I would reach out. Every single raw food company should have a nutritionist working for them. So, like Adored Beast has amazing customer service. I always tell people that they should go to whatever they're purchasing, whether it's a supplement, whether it's food, it doesn't matter, and reach out to them and ask that exact question, because depending on what the premix is, like what a premix formula is, they might say, oh yeah, we use a lot of organs that have really high B. I would be very careful with that. Or they might say, no, it's absolutely fine. If you're just sprinkling it on the top, like the tiniest little bit, just to get them going, I can't see it happening, but I wouldn't feel comfortable saying yes or no for sure, unless I knew the nutritional components of that. But they should have a nutritionist that would be able to answer that question in like 3 seconds.
Okay, thanks. And Cynthia, she has a cat with severe food allergies. She breaks out into hives. She's itchy and constantly licks herself to the point where she scabs. She tried over 10 different homeopathy. IPs was the one that looked promising, but for about 1 month, and she was getting better, but now she's back to square one. Trying the net more now. I've also been giving her Felix Flora since June, but that's not doing anything. She was giving her love bugs previously. The only proteins that are tolerable right now are duck, venison, and bison. She was eating raw before, but decided she doesn't like it anymore. So it's canned duck, air-dried venison, and bison treats. What else you recommend?
So, for this kitty, what you want to try and really do is modulate her immune system. And I sound like a broken record. I would look at her life quality. Is like, when you look at allergies and you look at food sensitivities and you look at at leaky gut and you look at, like, there is a billion things when we're thinking of allergies, like a billion. And are they real allergies, or are they severe food sensitivities? Because severe food sensitivities can show up just like allergies, but the hivey thing and all that. So when I hear hives, the first thing I think of is her liver, right? So liver is what regulates histamine. And so I don't know if you've done the feline leaky gut protocol. I don't know if you've done that, but I would seriously think about putting her on the leaky gut protocol. And I would be trying that. And I would be also trying different homeopathic remedies other than, I don't know, 10 different ones. I don't know I'm not sure which ones you've tried, but the ones that we've had the most success with stuff like that would be actually histaminum, the homeopathic remedy called histaminum. Carcinosin is a really huge one for that. But I often recommend my colleague Andrea Ring, if somebody wants to put her contact in the chat, please, that would be great. And she would probably be able to really nail down her exact homeopathic remedy that she needs. But from a perspective of immune modulation, I would be looking at putting her on turkey tail, and turkey tail and the leaky gut protocol. I would seriously be looking at, and lots of liver tonic. So I would be giving her liver tonic 3 times a day and trying to heal her gut, because a lot of food sensitivities and a lot of food allergies is because their mucosal lining is stretched, and they have, they go into one thing, but all of these proteins are leaking into their bloodstream. So they're becoming allergic or sensitive to all of them. Like, as the weeks and the months go by, there's going to be less and less and less food that she can eat. So that would be my suggestion. And I'm sure obviously you're doing homeopathy, you're doing all of that stuff. It's clear how much you love your cat, but I think it would be really a good idea to step back and go, okay, what does she really love to do? What does help her maybe not itch? Is she bored? Does she get enough stimulation in the day to keep her mind and her thoughts off of, scratching herself silly? CBD is another thing for cats that works really, really well for when they're in that point of no return, right? So you've got 2 things going on. You've got that she's so itchy that she's going crazy, and then she itches herself so much that itching is actually causing more trauma to her skin. So that it's this terrible vicious circle. And while you're playing with remedies, something like this, it's really great to do constitutional treatment, which is one remedy at a time. But you may not be able to do that right now. You might have to add some different remedies at the same time. And then, once she's better, once she starts to level out, then find her exact constitutional remedy and just give her that sort of as the one that's going to hopefully kick her over into really profound healing. But to get her better quality of life, and to be able to give her something that doesn't have side effects, aconite and arnica are amazing to give on a regular basis, which is in our go-to for animals that have hives, that have this like really, really intensity, right? Aconite is arnica and aconite is intense trauma remedies, physical and emotional trauma remedies. And when you think about that, and I just listening and reading that, she's got physical and emotional trauma, 100%. She's itching herself to death because she's physically itchy. She's got hives, but then she's compulsively licking, which everybody knows, like get a mosquito bite and you start scratching it. And then just imagine what that feels like. It feels like you're going to go crazy, right? So arnica and aconite on a regular basis with some CBD oil, just to take her cortisol levels down, would be something that would be really good. But, working with Andrea, she might put you on carcinosin. She might put you on a type of homeopathic cortisol, just to try to level out her cortisol from her stress. There's so much you can do to help your cat. Like don't give up, for sure, because I've seen tons of this.
Thank you, Julie. So Jennifer is asking, what's the longest you have seen a cat being on antibiotics because of the bacteria in their kidney?
What?
What's the longest you have seen a cat being on antibiotics because of the bacteria in their kidney?
In their kidneys?
Yeah.
So bacteria in kidney is called pyelonephritis. So I think I need to know if that's what it is, because pyelonephritis is different than a bladder infection, right? So when you have a bacteria infection, oh my goodness, is that her? No. Is that the same person? No, it's a different Jennifer. And we forgot, did you jump past Barb?
Yeah, no, I'm going back to Barbara then.
Okay. So antibiotics can be given a long time for pyelonephritis. Hi, not a bladder infection. Okay, so if it's an actual kidney infection, that's pyelonephritis, which is pretty rare, but it definitely does happen. They can be on antibiotics for a very long time. with pyelonephritis. You know, I can't really speak to, hopefully they're doing ultrasounds to measure, because pyelonephritis is very hard to gauge whether you're actually dealing with the infection, because it's encapsulated in the kidneys, right? So it's contained in the kidneys. That's a tough question, a long time. But saying that, if your cat is on antibiotics for a really long time, you need to be trying your very, very best to derail the side effects of having them on antibiotics for so long. So you can give probiotics. You just have to make sure you're giving them 6 hours before or after the antibiotics, so that that they aren't interactive of the two. And superoxide dismutase, big time. Phytosynergy, massive amounts of phytosynergy, like not massive amounts, but you know, phytosynergy, things to build your kitty's immune system, like the probiotics, like the phytosynergy, and definitely liver tonic, because liver tonic really supports the kidneys to stay functioning. You know, and if your cat has pyelonephritis, we want to make sure that all of the other organs that do detoxification are healthy, right? So we want to make sure the pancreas is okay, that the liver and the gallbladder stay healthy. So liver tonic, phytosynergy, and a probiotic is where I would go with your kitty. And just to be able to make sure that, and diet, I don't know what kind of diet he's on, but make sure that he's on a fresh food diet, or what we've been talking about, diet related. But they can be on it for okay, she does get Felix flora, but I hadn't spaced it out, and she gets phytoplankton. Okay, good. That's good. I would put her on liver tonic and space out the phytos flora for sure. The other thing, you know what? I was just thinking, why don't you alternate phytos Felix flora with feline gut soothe? Because, or even easy peasy, but feline gut soothe will really help to address any interstitial lining. So the interstitial gut soothe helps with lungs, cats, asthma. It helps with bladder infections. That's because of the slippery elm and the marshmallow root. It helps with like bladder walls, like I said, interstitial cystitis, but it helps with any kind of lining. And so we want to make sure that the interstitial membrane of the kidneys stay healthy. So you could actually be going one day Felix flora, the next day feline gut soothe, and make sure she gets phytoplankton. If she's liking it, she can get phytoplankton twice a day. And I would definitely put her on liver tonic, and then hopefully she's getting her kidneys ultrasounded to be sure that they're recovering.
Wonderful. So Barbara asking, I have a 2-year-old male cat who has CKD, creatinine 5.9, BUN 147, FOS 13.6. He's eating raw food, and I give Venges detox and Humpart. I don't know if I said it correctly. Is there any advice you can give for his condition? I will administering sub-Q and phosphorus
binder
later this week. Thank you.
So my first question is a 2-year-old cat with that. I wonder what happened. You know, like, so you have to intervene right now for sure, like you're with what your veterinarians are recommending, definitely, because you know, you don't want to have this looks, Barbara, can you write in there if your vet has said this is an acute CKD is chronic kidney disease, but a 2-year-old with chronic kidney disease is really unusual. I'm wondering if he has some kind of something that he was born with, like if his kidneys aren't functioning properly from birth. Definitely liver tonic, 1,000,000%, because it supports the kidneys. And when you're 2 years old and your kidneys aren't functioning, again, you want to make sure that the rest of the organs stay healthy, right? So if your kidneys aren't detoxing, you want to make sure that your liver, gallbladder, and pancreas are optimally healthy. So, but it does have herbs in it to support the kidneys for sure. So I would be putting them on liver tonic. I would also be reaching out to a homeopath, because again, I don't know whether this was an acute kidney thing or it's a congenital defect, but there are tons and tons and tons of things you could do for CKD. And the opposite is like you want, if you're going to do a phosphorus binder, the homeopathic remedy phosphorus is one of the most amazing homeopathic remedies for kidney disease, because it works as likes cures likes, right? So as vets have a hard time getting their heads around this, that's why you should reach out to a homeopath for sure to help you. If you tell your vet that you're going to be getting homeopathic phosphorus, they kind of like have a heart attack. And so they should, if they don't understand, because they're like trying to decrease his phosphorus and bind his phosphorus, and you're giving him phosphorus, but you're not, you're actually giving him homeopathic phosphorus, which helps to regulate the phosphorus. So I would suggest, again, if you did put Andrea's thing in there anywhere, and food, right? Like, I don't know what this cat's eating, but I definitely would not have him on dry food. I would be talking to your vet about putting him on a canned food or a dehydrated or a reconstituted dehydrated or freeze dried. And yeah, I don't know, because it's not in here whether this was an acute thing that has caused chronic kidney disease, or if it is a congenital thing. But there's lots and lots of stuff you can do, especially for a 2-year-old, like lots. So I would be definitely reaching out to Andrea and having her help you support your cat.
Okay, so Jennifer, that's not exactly a question, but she's telling about her cat's behavior, like food behavior. Like, my cat is 16 years old and seems to be doing very well, but aside from that, he tends to vomit a lot. He eats primarily dry food, which I know it's not good, but I've switched him over to canned food and raw food, and he was doing good for about a month or two. But then I can't remember if he started vomiting sporadically or if he just stopped wanting to eat different canned food and the raw food. It was as if he was boycotting it and turning his nose up at it. So I'm not sure if he was getting sick on it and then attributed it to the food or vice versa. Either way, I ended up putting him back on dry, and he didn't vomit at all for a good while. Now he's starting to do it again, but it goes in stages. He will vomit right after he eats, and if he scarfs and barfs, or sometimes it won't happen for about 30 minutes to an hour after. Sometimes it doesn't happen for several hours after. Also, he throws up when he doesn't have food on his stomach, but he's got a lot of hair in the vomit from licking himself.
Okay. Well, there's a lot, and I get it, because it's hard to really be sure what's doing what. But it's hard to know whether he just went off of it or whether he, what's happening. So he's 16 years old. I'm wondering if you gave him small amounts of a really good quality canned food. So convoluted, I know. I just wonder if he has a tumor or something, because his blood work comes back good. Well, there's definitely a way to find out if he has a tumor and have an ultrasound done, which is what I was going to suggest. If his blood work is good and you could find a clinic that won't sedate him to do is, and if he's good to, you know, you really shouldn't have to sedate a cat to do an ultrasound, and an ultrasound can show so much. It can show whether he's got inflammatory bowel disease, which he could have a tumor, like you're saying, he could just have food sensitivities, he could be, you know, there could be a million trillion different things going on. So from a perspective of diagnostics, I would get an ultrasound done and try, because of his age, try not to have it with sedation if you can help it. But if everything looks perfect in his blood work, it's not the end of the world to have an ultrasound done. If all of what I said didn't come through the question section. Oh, okay. So I would have an ultrasound done. I would get up-to-date blood work to make sure that he can deal with sedation if they want to sedate him. I would have an ultrasound done, but I would try so hard to get him on gut soothe. I would try really, really hard to get him on gut soothe. And there's lots of homeopathic remedies that are incredible. I tried and he still got sick. You tried him on gut soothe. Is that what you're saying? I think that's what yes. Okay. So then I would try homeopathic remedies. I would try, but sporadically, gut sick sporadically. Did he get a little better on gut soothe? Did it may have? Not really. Okay. How long did you try for? Try using a smaller dose. How long did you try the gut soothe for? 1 week. Oh, that's not long enough. That's definitely not long enough for if it is IBD. So I would get an ultrasound done. I would try getting him back on gut soothe. I would try the homeopathic remedy go-to for sure. Not sure. Oh my goodness, it's going back, but he doesn't keep the food down, then doesn't want to eat any wet. So how do I give it? Well, you can actually mix it in a little bit of water and get a syringe and squirt it in his mouth before he even eats. So don't do it just prior to him eating. Take a little bit of gut soothe, add a little bit of water, mix it in a syringe, squirt it in his mouth an hour before he eats. And so even if he gets sick, do it again later. Even if he gets sick, do it again later. I don't know what she's asking now, sorry. When I give it in a syringe, so even if he gets sick, even if he throws up right after you give him it in the syringe, well, I don't know if he would do that because I'm not sure if he's throwing up I don't know whether he's throwing up the gut soothe or he's actually throwing up the canned food. I'm not sure. I'm just trying to give you a few different ways that we have used it in the past. And one of that is to give it through a syringe or an eyedropper an hour before feeding and see if that happens. But what I would also do is I would definitely start trying to get him on some homeopathic remedies. You could start off with just some go-to, right? And just routinely give him some go-to 3 times a day, mix it in water. And don't give it to him straight for sure. Mix it in some water and give it to him. I don't know how much water he drinks, but you could actually give it to him in his water. You could put it in his water, like put 1 little squirt of go-to in a big bowl of water and see if that would be helpful for him as well, because it's got arnica and aconite in it. Sometimes helps to really calm down the gut. But I would get an ultrasound done just to find out what's going on with him for sure. And then I would try doing the gut soothe in his mouth and then feeding him an hour later and see how it goes.
Stacy is asking, what if rabies is required by law in my state? Pure Vex rabies.
Rabies, where are we here?
Stacy. the
Oh.
bird.
What if rabies is required by law?
And yeah.
No. For indoor cats? Is it an indoor cat or an outdoor cat? I don't know. I don't know. It's a really hard call. Maybe you would have a really nice vet that, certain vaccines are better than other because they don't have the the antigens in them. And I think PureVax is one of those, supposedly. But again, you're still injecting a killed rabies vaccine into your animal. So I would see if there's any way that you could find a vet that would, I don't know, Stacey, it's such a hard call. It just irritates me so much. That's a really hard question for me to answer, because if it's a legality, it's a legality. I'm a big one about for, giving dose dependent vaccines, like not give the same amount of a rabies vaccine to a kitten as you would to a Rottweiler. And that's still a lot of questionable ethics around that piece. I don't know. I would try and avoid it for as long as I possibly can, and talk to as many vets as you can and see if there's a way around it, or see if there's a vet that will do a dose dependent one. I don't know. That's a hard one.
Yeah. Well, Carla is asking, my 13-year-old Siamese is very picky with her food and she tends to vomit every morning. She eats twice a day, but I'm not sure why she vomits her food. She also poops outside her box. No change or anything at home or food. I have tried the feline gut soup with her food and she refuses to eat it if it's mixed in her food. What could be happening with her? Thank you.
I wonder if she vomits every day. Oh, I don't know.
She said that she vomits every morning, so probably
every morning,
every day. Yeah.
every morning, but she in the morning.
Yeah, interesting.
I wonder if it's worth, if it's before she eats, Carla, you could try feeding her something small before she goes to bed. And I would try doing what I was saying before, is mixing it in a little bit of maybe raw goat's milk. If any of your cats will eat raw goat's milk, and mixing it in raw goat's milk, you can try it, or mixing it in raw goat's milk and then squirting it in her mouth. You could try that too. So it's not just the gutsu, it's a mixture of both of them. But pooping outside of her box, it sounds like she feels really sick. Like, the pooping outside the box and vomiting, it does sound like she's got some pain going on. She's only 13. 13's, if her blood work is good, I'm a big advocate of abdominal ultrasounds. I feel like you can really rule a lot of things out when that's happening. But remedies, homeopathic remedies for cats that are really good for all vomiting cats. Good ones to look at are phosphorus and arsenicum, and phosphorus, arsenicum, and nux vomica are three really good remedies for vomiting cats. There's Don Hamilton has a really good book on how to give remedies with cats. So does Dr. Richard Pitcairn. He's just got a new one out, a new revised edition. There's lots and lots of good information in those as well, of how to give. And we have it in our, we've got how to give remedies for vomiting cats and dogs in our Are You Vet Ready series. And Emily, I don't know if you're still on here, but do we have a blog we have a first aid blog or a homeopathic blog on how to give animals remedies?
Lots. I'll put them all in the chat.
Okay, perfect. Thank you. So, Carly, you might want to look at that as well. But I would mix a little bit of it and squirt it in her mouth and try feeding her at night. Try giving her a little tiny bit of food before she goes to bed. Does it say what she eats? Food doesn't say what she eats. You might need to change her diet too, right? So, maybe change her protein, maybe try different kinds of proteins with her and stuff, but it's a good place to start to do an ultrasound. Or if you don't want to do an ultrasound, start trying some different foods with her, give her some gut soothe, and look at some of the remedies that you could give her.
Thanks, Julie. So L. Potts, I don't know for the first name, regarding thyroid testing, what items should be tested?
So regarding thyroid testing, there are panels. So I would just get a thyroid panel test done. With dogs, we always used to say, oh, dogs need the thyroid panels, cats just need a T4 TSH, but there's more and more research that's coming out. It's really good to do panels. It gives you a much bigger range of what's going on.
Nice. Elisa is asking, my cat has just had international resectional surgery due to blockage. Yeah. He has IBD in 3.5 years. We are 3 weeks post-surgery, and I'm after a plan for helping with him with the recovery process. He is being fed by feeding tube. Should I use the rebalancer? He's being put on a short course of steroids, unfortunately, to address reactive lymphoid hyperplasia from a biopsy.
He has IBD, and that says, has he had IBD for 3.5 years, or he has IBD and he's 3.5 years old?
Yeah, the way that I'm reading that he is 3.5 years old and has IBD, but yeah.
Yeah, just a second. Okay. That's a lot. Yeah, that's a lot. It's interesting that he had a blockage. I wonder if he ate something. For me, definitely the healing piece has to come in. It's a big, and you do want to address the hyperplasia for sure, but I wouldn't be doing rebalancer. I would be doing go-to, and I would be doing homeopathic remedy called Nux vomica, a really low potency of Nux vomica, just to help him deal with the steroids. I would be putting him on liver tonic, 1,000,000 trillion %. Phytoplankton is really, really good for stuff like this because it doesn't need to be digested. It doesn't have to go through the digestive system. It's absorbed. It's absorbed through prior to even being digested. So you can get lots of good nutrition into your cat, and you can ask them if they would allow you to mix a little bit of it in his feeding tube. I don't know if you're feeding him with the feeding tube. I'm not sure if he's on like a really strict what he can have to eat perspective. I'm also not sure if he's still on antibiotics, but when I look at all of this, it would be trying to just get his gut back to balance, right? So probiotics, feline gut soothe, something like Nux vomica, and the go-to is really good for healing. It's really, really good for healing. So it's because it has arnica in it, or just go and get some homeopathic arnica and some homeopathic Nux vomica. But once you're doing all of that, I would highly suggest, I don't know how he had the blockage. What, did he have a blockage because of his IBD? Or did he have a blockage because he ate something that he shouldn't have eaten, right? And got a blockage that way. But it is, there's so many different things, like in our leaky gut protocol. Like I'm almost feeling like that would be good, except for I don't think he could handle the digestive enzymes right now. But the homeopathic remedy in the leaky gut protocol is exactly for that. It helps to heal and support the healing process of the lining of the bowel. But it has a particular remedy in there that helps to decrease negative scar tissue, right? Or scar tissue that is going to cause like an adhesion or something, which I'm sure you're probably also worried about. But for now, from a perspective of just healing him, Nux vomica 12C, once a day to help for the steroid, and arnica 30C twice a day for 2 weeks would be really helpful. Giving him phytoplankton and liver tonic would be the two things that I would be looking at, along with some probiotics.
Thank you, Julie. So Violetta is asking, a 5-month-old kitten came with calicivirus from breeder at 3 months, no vaccines, had sniffles, nasal and eyes discharge. Was on Tobax for a week due to some scratches around an eye. After that, I treated him homeopathically only. I'm not sure about.
Is that a question though?
Yeah, there's no question. Like it's
Okay,
just...
well, good for her. That's awesome.
Okay, so
Awesome.
Kim asking, 11-year-old keep having reverse sneezing and sneezing with some asthmatic hacks. Feed raw on feline gut suit, Felix Flora and phytosynergy. Sorry, it's better that it was, but I can read it.
Reverse sneezing with some asthmatic. Oops, I lost it. Where'd it go?
It's here, the first one. Kim.
Right. Okay. Yeah.
Demico.
Well, when I look at that, I think that we're still not. When we think of asthma and we think of reverse sneezing, to me, there's still a histamine element to that. If he's not on liver tonic, I would try liver tonic. The other thing that you could try with that is, I'm talking about go-to a lot tonight. I don't know why, but I think it's because homeopathy works so great with cats. They're so they just connect with homeopathy so well. You could try doing some go-to, but you have to make sure that you mix the go-to in water and then give it to them. Don't just give it to them. Don't just give them go-to straight. And that might help with some of the inflammation, the sort of like, intense inflammation. So I would try that. Just maybe do it 2 to 3 times a day for 3 days, and then twice a day for a week, and just see if it sort of settles down. But I definitely would put them on liver tonic to try to get down some of that histamine reaction.
Okay, thanks. I have a question here that actually it's not in the Q&A, but Emily's asking me to read it. So it's from Margaret. My cat was vaccinated for rabies before she came as rescue from the Bahamas to Nova Scotia. I'm vaccine hesitant and don't vaccinate once they are in my care. She was diagnosed with stomatitis, which is now in remission with the help of an amazing dental food that works both on the mouth microbiome and the gut, but also now has tooth resorption. I have.
Okay, where is this?
I can put in the chat. I have many questions for managing both stomatitis and tooth resorption. I'm sorry. I'm on limited income.
Reabsorption, probably, she's saying. I can't find it to read it.
Let me
Sorry,
put here.
sorry,
I'm putting
I hate to
here in the
interrupt.
chat. No
Sorry.
worries.
Sorry, I hate to. This is my fault. I sort
Right.
of answered the question, but I didn't answer it fully, and it disappeared. And Margaret asked this question really early on, and I don't want her to miss her answer.
Okay, we asked people, hi, Margaret. It disappeared?
Because
Yeah.
I answered it. So here, I'll put it in.
It's
the
in the chat,
chat.
Julie, for you. I
It's in
sent you
the
a
chat?
I sent you
Oh.
a directed message.
There, I put it in the chat. I'm very sorry, Margaret. I know you're waiting very
Okay, hold
patiently
on,
for an
hold on,
answer.
hold on. Okay, my cat was vaccinated for rabies. Oh my goodness, hang on, guys. My cat was vaccinated for rabies before she came as a rescue from the Bahamas to Nova Scotia. I'm vaccine hesitant, don't vaccinate once they're in my care. She was diagnosed with stomatosis, which is now in remission with the help of an amazing delta food that works both on the mouth microbiome and the gut, but now has tooth reabsorption. I have many questions for managing both stomatosis and reabsorption. I'm on a limited income, spend a lot of money on supplements for both my cats. I'm not sure where to start with your products, not sure about mixing another probiotic with something I'm giving her presently that also works on the microbiome. What would you recommend that I do first with your products? The dental food has a formula that works on the microbiome and the mouth, on the mouth and the gut. Okay. So, part of stomatosis, depending on what it is, especially if it's immune mediated, does cause, it's sort of like the later stage of the stomatosis, like if the stomatosis isn't, like if it's managing the pain, that's really, really good, because it can be such a painful thing. But we're still getting the reabsorption of the tooth, right? Which is part and parcel of that same disease. I would limited income. And okay, I think they're not expensive. I would go and try and find a homeopathic remedies. They're like $8. They're really inexpensive. Go to your health food store and see if you can get a homeopathic remedy called, can I type on this? I don't, yes, I can. Kelk floor. I think it's, oops, hold on a second. Floor and kelk boss. And get them, boss, and get them in a potency called 12C. And give that like twice a day for a month. That helps with the integrity of the actual enamel and of the tooth, to help strengthen the tooth. The other thing that I would do for your cat, from a perspective of what to buy from us, would, and I know this is going to sound crazy, but is actually Jump for Joints. And that's because it has homeopathic remedies in there that help with the integrity of bone. So the periosteum of the bone, the blood flow of the bone, the cartilage and the tendons and everything that holds your teeth together, right? Everything that keeps the integrity of the actual way that the tooth is held in the mouth. And it also has arnica in there, which is incredible for pain. So if you want to start off with one thing for the tooth, that those homeopathic remedies are really, really, really inexpensive, like super inexpensive. And what you could actually do is go and get them, and this is going to make it last a lot longer, is well, anyways, it'll last. It'll tell you to probably give 4 pellets. You don't have to give 4 pellets. You can give 2 of each. You can put 2 pellets of each one of those in a glass of water and take a syringe from that same water for 4 days. And you can give that to your cat, 2 or 3 times a day. And that will make those pellets last for very, 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 very long time. It'll last you a really long time. You don't have to use 4 every single time you're doing it, like it says on the container. And then try the jump for joints. See where that lands after a month. Maybe reach out to customer for service and they can let me know and remind me who you are and let me know how it goes with that. That's what I would try to do. That's like the first thing I would try and do is just deal with the integrity. Like if you believe that the food that you're feeding is helping with the gut microbiome and with the dental disease, the stomatosis, stay with what you really think is working well. Don't jump ship with that, and add on those really inexpensive remedies, and add on jump for joints. It'll last you, doesn't go bad. It'll last you a really long time. And then reach out to customer service and let us know if there's any slowing down of the reabsorption. And if there isn't, or if it's not slowing down fast enough, the next thing I would go on then for your cat would be phytoplankton, the phytosynergy. And that's to try and get the body to be able to produce more of its own antioxidants to fight oxidation, which is a big part of what's going on in your kitty's mouth.
Thanks, Julie. I want to go back to Violeta's question, because actually it was a question, but it didn't there was not like the full question over there. So reading again the first part, 5-month-old kitten came with calicivirus from breeder at 3 months. No vaccines, had sniffles, nasal and eyes discharge. Was on Tobax for a week due to some scratches around an eye. After that, I treated him homeopathically only, and he is to be neutered on September 5th. Question 1, is it okay neuter if not fully recovered? And 2, once healed, should he receive a calicivirus vaccine? And 3, should he receive any vaccines on when healed?
Well, can you show me where that is so I can read it? Did she add to it?
I'm gonna put here in the chat. So the here, it's in the chat now.
It's in the chat, or it's in the question?
In the chat.
Okay. Where?
The
Sorry.
last thing in the on the chat.
On the question Q&A?
No, the chat.
Oh, the
I
chat.
just wrote, 5-month-old kitten came with.
After I treated him homeopathically only he is to be neutered on September 5th. Oh my goodness. September 5th. Is it okay to neuter him if he's not fully recovered, once healed, should he receive? He's 5 months old now, right?
Yes.
My honest opinion, I can't tell you, and I can't recommend what you do. If he is the only cat in your house, so you're not worried that he's going to impregnate another cat, or he's not going to run away, right, to try and breed another cat, I would try to wait till he's healed before I would neuter him. I mean, when you neuter something and you reduce all their sex hormones, it massively affects them, no matter how you want to slice it or dice it. You know, a lot of vets believe that they have to be done before 6 months. I would say that's true. That's probably true if they're going outside and you don't want them to start spraying and all of that stuff. I get that. But you also don't want a cat to have to be dealing with calicivirus for its whole life and have constant eye issues and things. I don't know if you've put him on L-lysine, but L-lysine is something that definitely he could go on. Now, as far as, is it okay to kneel him? I mean, okay, so it's okay. Well, yeah, he's not gonna, you know, I'm sure it's okay. But is it ideal? Probably not. Maybe for 1 more month, wait till he's 6 months old, if you can, 6 or 7 months old, and get him on some L-lysine. And also, you know, I know you've got Andrea Ring's thing in there, but she has the homeopathic calicivirus nosode that works wonders on cats with calicivirus. It really, really helps them to heal. And should he receive any vaccines once he's healed? If he's an indoor cat, if he's going to stay an indoor cat, you know, once he's healed, should he receive a calici vaccine? My understanding and how I've been trained is that once your body has a virus, to give that virus to you again is sort of counterintuitive of how the body actually works with viruses. Like, so to give a vaccine to something that has already had that virus and recovered from it, that wouldn't be my first thing to run out and do. That's for sure. You can get more people's input on that, and you know, there's probably lots of stuff on that from a holistic perspective online, but that doesn't make immune sense to me. So from a perspective of immunology, once you've had a virus, your body should be able to respond to that virus. So when you're given a vaccine that you've already had the virus to, I think really is counterintuitive. And should he receive any vaccines once he's healed? If he's an indoor cat, the likelihood of him getting any kind of diseases inside is really low. So that's going to have to be something that you're going to have to weigh your odds, you know, like, you know, they'll say you can bring it in on your clothes, you can bring it in. You just have to be aware if you're someone that's, you know, at a cat rescue that works for a cat rescue, and you're around really sick cats all the time, and you're not changing your clothes, and you're coming home with other cat viruses on your body. I think people have to just understand, like, are they around a lot of cats? Are they around a lot of sick cats so that you can bring that virus into your home? If not, you know, for me, that's not something that I would do. You know, I have, like I said, I have 9 cats and none of them have been vaccinated for anything, and 5 of them are outdoor cats. So I'm a very strong believer in the innate ability for the maternal antibodies to hold them solid while they're young, and that their bodies have the ability to respond to things, you know. So some of my cats don't go out and some of them do go out. So, and I've got rescues that have been fully vaccinated, but I don't revaccinate them. So once they've been vaccinated.
Great, thanks, Julie. Can you repeat the name of the remedies you recommended for the stomatitis?
Oh, sorry. I actually should have put them in. Did you get them?
Let me
I
try.
just put them in the chat.
I'm gonna not yet because it's
Oh, it's getting lost.
here. Just because you didn't put to everyone, just for hosting.
Oh, okay. Sorry.
panelists.
Thank you.
And can I ask the last question because it's really, really late for us? It's almost 10.
Yeah.
So Kimberly is asking, why would my cat have scabs on neckline and near base of tail? Vet keeps saying it's fleas, but she sleeps with me and I've never seen a single flea. If she had fleas, I would get beating too. So maybe you can figure out what's going on.
Where's that one?
Here in the Q&A. The first one in the Q&A, Kimberly.
I can't find it. All right. Well, sometimes, I mean, first of all, did they find flea dirt? Like, is the vet saying that the cat has fleas because of flea dirt? So if she's got scabs, are the scabs coming because she's itching herself? Do you know what I mean? Like, is she creating the scabs? Because if she's not creating the scabs, something's creating scabs. Something's either biting her or she's got some kind of a dermatitis. But there's this. Can you ask her if she lives in the United States or in Canada?
Kimberly, I don't know if you're still here with us. But if you can answer if you live here in Canada or in the US, it will be great.
And I understand why the vet's saying that, because usually that's where the scabs are. Like, that's where the bites are. They're around their ears, they're around their neck, and then they're around the base of their tail. That's usually where the fleas go. And she's never seen a single flea. That doesn't mean that there isn't one single flea. If a cat has a flea allergy dermatitis, they just need to be bit once by a flea and they can create a whole bunch of problems. But if Kimberly, if you're living in the US, you could get onto the Wonderside website, and from a perspective of the least toxic there's thing to use, you could try, but be very careful, because some cats have a really high sensitivity to the cedar wood in it. But there is, or you know what? Can someone put Rita Hogan's contact in the chat for Kimberly, and reach out to Rita Hogan, because she has some good suggestions with herbs that you can use for fleas that have really great results. I would try that before I would go down any other crazy thing like allergies and things like that. I would try using a really, really non-toxic, safe flea control, just to see if there's a change. Again, I don't know. If it is an allergy, it could be an allergy to something, and it would be like, did you use any new soaps? Have you used any new fabric softeners? Do you have like stinky things that you plug in to the wall, like Febreze things like that. Those all can cause allergies. And putting some essential fatty acids on her food, like our potency or phytosynergy, and giving her a really good probiotic, so that if it is, making sure that she's on a good food, like If it's something coming from inside out, Kimberly, if that's what you're asking, then we have to work from inside out. So we should be working from inside out, whether it's fleas or not fleas. So make sure she's on a good diet, make sure she's getting a really good probiotic and getting essential fatty acids like an EPA and DHA, so that you've got those three bases covered that predominantly are the underlying cause of skin disease. And then use a really, really safe flea product to be sure that she doesn't have any kind of fleas at all, for sure. That's what I would do.
Thank you, Julie. Guys, it's getting really, really late.
Yeah, I know, I'm
so-
getting screamed at by the barn.
So I'm wrapping up here. But I know that we still have like a lot of questions. We answered a lot of other questions too, so I'm very happy and glad for that. But please, for those who didn't get your questions answered, please join us in our community on Facebook.
Michelle, just wait. Michelle Morale asked if it would be, if this is going to be on replay. It will be on YouTube, right?
Yes.
Okay.
It will be on YouTube. So please join our community on Facebook, the Derby's Collective, and you can post your question there and we will be glad to help you. And so I would like to thank everyone that joined us today, and of course thank you, Julie, for your valuable time and for this amazing discussion. I don't know if you have any final words for the cat lovers.
Well, it's just, they're near and dear to my heart. They're very different than small dogs. Judy Morgan and I had a conversation, and Dr. Zoolittle and everything, and nothing upsets them more than people thinking that dogs or cats are just like little dogs when it comes to food and supplements and care and all that stuff. They're not. They're a totally different beast, and they have, they really do get they don't get enough behavioral information. We don't get enough behavioral information for them. We don't get enough nutrition information for them. So thank you so much, everybody, for showing up. And, our customer service team is incredible. So if you didn't get your questions answered here, you can always reach out to them too. There's cat lovers amongst all of us. So
yes,
thank you very, very, very much. And the community too, like on Facebook and things like that. Just, reach out to your support, your feline supporters, and yeah, just thank you so much for showing up.
yes, thank you again, everyone. And don't forget to subscribe to our newsletter if you want to keep up with all the info that we share there, and also with all our promos. So if you go to our website, you can subscribe for the newsletter there. And thank you so much again, everyone, and stay safe and have all a good night. Bye-bye.
Bye, everybody.